you're making a intervention that is actually going to make the problem worse. Right now, unfortunately, apart from vaccination and some stuff in workplaces, there's not a lot of levers left to pull. And what you have to do is not make things worse. And by driving people indoors, which is what these new rules will do, it's actually going to make the problem worse. So I really hope that this is something they pivot on, because I don't think that closing outdoor spaces is the right thing to do.
Not enough, and I think it's a little too late. We have a significant problem now really on our shores, and I think the direction where we've headed and what we signaled yesterday was good, but really should have been implemented 6, 8, 10 weeks ago, when all of my expert colleagues and everybody in the medical system was asking for them.
Okay, let's get to the numbers now. Ontario reporting 4,362 new COVID-19 cases today, down from yesterday's record high of 4,812. There were also 34 deaths, the highest since February 19th. Locally, there were 1,162 new cases in Toronto, 936 in Peel, 430 in York, 301 in Durham, a record for that region, and 251 in Ottawa. We're also seeing 2,065 hospitalizations due to COVID-19, the first time that number has surpassed 2,000 during the pandemic. There are also 726 ICU patients. Almost 56,900 people were tested. The Chief of Staff of Burlington's Joseph Brant Hospital talked to us today about the rising ICU numbers.
The challenge is going to be how long this lasts, because these types of care models are in fact unsustainable. Redeployment of nurses and staff moving into unconventional space inevitably will take a toll on our staff, our patients, and our resources, and affect the quality of the care that we're able to provide.
The Ontario Pharmacists Association is also concerned about vaccine hesitancy when it comes to the AstraZeneca shot. The vaccine right now only recommended for people 55 plus due to a rare risk of blood clots. Pharmacists are now concerned that some doses may expire before they can be used.
Important to get the vaccine that you are offered first. I've heard tremendously sad stories about people that declined to get the AstraZeneca vaccine and ended up in ICUs, and in some cases tragically passed away. So this is our most important message. One of the other challenges is that some of the mass immunization clinics that are run by public health units are offering the same age categories, the Moderna and Pfizer, so people are shopping around. And because of that hesitancy issue, they're choosing to go to some of those options instead of getting the AstraZeneca.
Health Canada says the vaccine is safe. Health officials also know 1 in 4 people hospitalized with COVID-19 will experience a blood clot.